Hello, my name is Corey Harkin and welcome to my presentation on statins and who should use them. In this presentation I am going to discuss what is cholesterol and the functions of it, the different types of cholesterol, what are statins, the drug development process which statins have to go through, taking statins, and alternatives to taking statins. Cholesterol is a waxy, fat-like substance which is found in all our body cells and enters our body from the food that we eat, such as meat and dairy products which are high in cholesterol, and our liver also produces cholesterol. The cholesterol that comes from the food that we eat is packaged into particles called lipoproteins, as cholesterol doesn't dissolve into the blood. Lipoproteins transport the cholesterol. Cholesterol's main function within the body is to aid the production of sex hormones, vitamin D, build human tissue, and assist in bile production in the liver. Having too much cholesterol can cause negative effects on health, as it increases the risk of coronary heart disease. Coronary heart disease is where coronary arteries become narrowed by the buildup of fatty materials, resulting in the formation of plaques called atherosclerosis. The symptoms of atherosclerosis depends on the location of the arteries affected. Atherosclerosis in your heart can show symptoms of chest pain and increased pressure. Atherosclerosis leading to your brain can result in sudden numbness or weakness of your limbs, difficulty speaking, slurred speech, temporary loss of vision in one eye, drooping facial muscles, and if left untreated, may progress into a stroke. Atherosclerosis reduces the amount of oxygen delivered to your heart, and if the plaque bursts, a clot can form on top, which can suddenly block your arteries completely, causing a heart attack. Coronary heart disease can weaken your heart also, and may lead to heart failure. There are two types of cholesterol: high-density lipoproteins, which may be referred to as the good cholesterol, and low-density lipoproteins, which may be referred to as the bad cholesterol. Low-density lipoprotein travels in the bloodstream and delivers cholesterol to the cells that need it. Too much low-density lipoprotein in the bloodstream results in the buildup of cholesterol and other fatty particles in artery walls, forming plaque, narrowing the arteries and reducing blood flow. Low-density lipoprotein carries cholesterol into the plaque, hence the nickname bad cholesterol. Therefore, a buildup of plaque increases your risk of coronary heart disease and heart attack. The liver also makes high-density lipoprotein, also known as the good cholesterol. High-density lipoprotein helps remove the excess cholesterol from the cells, tissue, and most importantly, from the fatty deposits which may be blocking our blood vessels. High-density lipoprotein soaks up excess cholesterol from the walls of the blood vessels and carries it to the liver, where it breaks down and is removed from the body in bile. Statins are a relatively newly discovered drug group that effectively lower blood cholesterol levels. Patients suffering with heart disease take this medication in tablet form, taking it on a prescription base. The prolonged use has been proven to reduce cholesterol levels, reduce the risk of cardiovascular disease, and increase the life expectancy of those who have cardiovascular disease or a history of cardiovascular disease in their family. Statins work by blocking the enzyme involved in the synthesis of low-density lipoprotein. This, therefore, is a competitive inhibitor of low-density lipoprotein, the bad cholesterol. This enzyme is located in the liver and is known as coenzyme A, or HMG coenzyme A reductase. The conversion of HMG-CoA into mevalonic acid is blocked. Therefore, the biosynthesis of cholesterol is continually reduced, decreasing cholesterol levels in hepatocytes, also known as liver cells. Hepatocytes respond to this change in state by activating nucleosterol regulatory element binding protein 2, which causes the upregulation of key genes which are involved in cholesterol metabolism, such as HMG-CoA reductase, and low-density lipoprotein receptors are also activated on the kidney. The upregulation of low-density lipoprotein receptors activity helps to mediate cholesterol-lowering effects, such as increased hepatic uptake of atherogenic ApoB containing lipoproteins, such as low-density lipoprotein, very low-density lipoprotein, intermediate density lipoprotein, and these are all bad cholesterol. So in simpler terms, the liver's function of breaking down and excreting bad cholesterol in bile is upregulated, decreasing the levels of bad cholesterol in the blood. So the decreasing effects of bad cholesterol in the blood decreases the risk of cardiac heart disease, stroke, and many other diseases caused by increasing cholesterol levels in the blood. Prolonged use has been proven to reduce the risk and life expectancy of people with a history of heart disease. The drug discovery process starts when there is a gap in the market for an unmet clinical need. In this case, it's atherosclerosis, and this clinical need was identified in the 19th century. In the 1950s, great effort was made by scientists to determine the synthesis pathway of cholesterol. This pathway then allowed a target to be selected, such as limiting the rate of HMG-CoA to mevalonate, which is a major point of regulation of the cholesterol synthesis pathway. As the scientists know the target, it does not need validating, which is the next step of the discovery process. The target is HMG-CoA reductase. As HMG-CoA reductase is a competitive inhibitor which blocks the conversion of HMG-CoA into mevalonic acid. The next step in the drug discovery process is lead identification. This is the process of identifying a drug which has the potential to be therapeutically beneficial. The first commercial statin was discovered in 1982, where patients with severe hypercholesterolemia were treated with lovastatin, and this showed lowering effects of low-density lipoproteins with very few side effects. This results in the large-scale clinical trial of lovastatin in patients at high risk and long-term toxicity was tested in dogs. The drug was well tolerated and dramatically reduced cholesterol levels, and no tumours were detected. In 1986, the new drug application was sent to the USA FDA, and lovastatin was given the approval to become the first commercial statin in September 1987. Since then, many different statins have been commercialized, with 5 different types available on prescription basis in the UK, known as atorvastatin, florvastatin, pravastatin, rosuvastatin, and simvastatin. Statins are taken orally in tablet form once a day. Your doctor may tell you a specific time you should take the tablet daily, but usually it's around the same time every day. Statins use is usually continued for life once the cycle has started, as if you stop taking statins, your cholesterol will return to a high level within a few weeks. It is important that if you forget to take a tablet, you don't take an extra one to make up for it. Instead, you should take your next dose as normal to prevent overdosing. If this occurs and you've taken an extra statin, or you've taken too many statins tablets exceeding your daily dose, you should contact your doctor or pharmacist to seek medical advice. It is important to know some statins may interact with other medications you may be taking, which has the potential to result in an increase of unpleasant side effects, such as muscle damage. This should be discussed with your doctor, making them aware of any medication you are currently taking, so you are prescribed the most appropriate type of statin. Most people who take statins experience no or very few side effects, and those that do experience side effects, they're usually minor, such as diarrhea, headaches, or feeling sick. Other side effects may include myopathy, which is the disease of the muscles where they don't develop properly, or rhabdomyolysis, which is the breakdown of skeletal muscles. Mild muscle pain affects 190 cases per 100,000 patients per year. Myopathy affects 5 cases per 100,000 patients per year. Rhabdomyolysis affects 1.6 cases per 100,000 patients a year. And this was stated in Medicines and Healthcare Products Regulatory Agency 2014 on the gov.uk website. A positive healthy lifestyle change can help reduce your risk of developing cardiovascular disease and lower cholesterol levels without taking statins and before your doctor may suggest you to take statins. Healthy lifestyle changes which can help reduce cholesterol levels and cardiovascular disease risk include eating a healthy balanced diet, exercising regularly, maintaining a healthy weight, limiting the amount of alcohol you consume, and stopping smoking.